Welcome to another edition of Journey of Hope. Thrilling stories of people that have been impacted by the healing ministry of Loma Linda University Medical Center. People that have been here from different places in the world that have undergone some kind of traumatic injury or an illness, treated for cancer, and have been impacted by the people that are caregivers here at Loma Linda University Medical Center. Our special guests today have an amazing story to share and tell. A story that's been going on for over 18 years. An amazing story. Our special guests today are Liz and Miguel from Chino, California, and a special guest, Michelle Vert from Riverside. We're glad to have each of you here. And we have people from around the world that are watching. And before we tell the amazing story, let's learn a little bit about your background. And for those that are just looking in and watching our program, we found out that Miguel needed to have a kidney transplant.
That's right.
And has been struggling really for the last 18 years, has already had one kidney transplant and undergone dialysis. And then we have a special person here that came under a deep conviction that they wanted to give a gift long before they knew any of the people that were involved. But Liz, why don't you tell us a little bit about the journey that Miguel has been on, really from the time that he was born, apparently.
Thank you, Dr. Martell, for that lovely introduction. It has been a journey with my son. When he was first born, he had a lot of health issues. We didn't think he would make it through the first 2 or 3 weeks, and they airlifted him to Chalk, and then we brought him to Loma Linda when he was about 3 months old, when he was stable, and he's been a patient here for the last 18 years, and they've done a great job of keeping him safe and sound and on the road to good health.
So even at the very beginning, what kind of challenges were you having?
Renal failure.
This from the very outset. Then.
Oh, they told me when I was pregnant that there was some complications, but of course they don't go into detail and tell you too much. And then when he was born, he had little kidney function at all. He had some cardiac issues. He was in the incubator. We couldn't touch him because he was in isolation because of the immune system. And then they got him stable and fixed his heart a little bit. And then once I could get him transferred closer to home, we came to Loma Linda, and we've been here ever since.
Now, what kind of help were you receiving from Loma Linda from the very earliest time? I mean, you brought him home, and then he got 3 months later, you bring him over here to Loma Linda. And what kind of help were you getting at this point?
There were social workers, there was referrals to Inland Regional Center, home nurses that came out and helped me. I had 3 other children that were under 5, so this was a big endeavor, and I didn't have a clue. I was a young mom, but they were great. They've always been there on the phone. If I needed to go to the ER, I've always felt supported and encouraged, and everybody's on the ball, and they all just work together. It's all about the patient and the family, and it's not just paperwork or charts. They really look at the whole spiritual part of the family and the patient.
So, and then at one point, I don't know how many years ago, apparently Miguel had a kidney transplant.
Yes.
And how long ago was that?
He was about 12 years old when he finally went into renal failure, and we went on the list and we started dialysis, and that lasted about 2 years. And then he received a cadaver donor, and his body rejected that. I believe it was from the stress of things that happened afterwards, other surgeries that he needed. And we were just waiting for this kidney to completely malfunction. And when it did, we were just about ready to start dialysis. And we had started the homeschool program. I'd made arrangements at work, you know, let the whole family know, and we were all ready to go with that, mentally and spiritually preparing. And then we got the phone call.
You got the phone call.
The phone call.
And Michelle, that's where you come into the picture. But, you know, for our listening audience, let's tell us a little bit about yourself. Where are you from? How long you been here in the area? And apparently you came under some kind of a deep conviction somewhere along the line that you would like to be a donor. And on our program, we've had different types of people that have shared different kinds of experiences. And believe it or not, Journey of Hope is a listener-sponsored program, and so we do talk about philanthropy and giving back. But the type of donation you're talking about giving was a gift that continues to give and give and give and give. But tell us a little bit about yourself. I understand you're getting ready to do some schooling, but right now you're currently working where?
I'm working at Pep Boys right now.
At Pep Boys. And apparently you enjoy working with automobiles and
Oh yes, oh yes.
That's kind of
that's my life.
that's-
Oh man,
that's what really
that's what I want to do. I want to be a hot rod shop owner. That's my goal in
You
life.
want to be an owner.
Oh,
Okay.
yes.
And you're going to be taking some schooling, and what kind of schooling you're going to be doing?
I'm currently in school for it, but now I'm switching schools. I'm going to go to Wyotech now and get my AS in it.
Okay, good
So,
enough.
yeah.
And getting ready to go back to work. You've been off to work. And really what we're talking about, particularly here is during the last couple of months, we're at really about a little bit 2 months out.
Yes.
But some time ago, a couple of years ago, Michelle, if I understand the story correctly, you came under a conviction that you'd like to donate.
Yes.
And what were you going to donate?
I was donating my kidney.
You were going to donate a kidney. Now,
Yes.
you didn't have any donor in mind, I mean, any recipient in mind.
No.
How did you come under this kind of a conviction? I've never had that conviction that I want to give my kidney. So how do you come under a conviction you want to give a kidney?
Yeah, it's about the children, you know. It's I'm just really sensitive to children. It's just how I am. That was the whole point, is I wanted somebody under 18 to live, because I always hear the statistics how 17 people die every day on the waiting list, and you know.
So in other words, there are 17 people that are not lucky enough to find a
Yes.
donor, and they end up
sitting on that list.
they pass away.
Yeah.
So that many. So somehow you became aware of this, and a
Yes.
few years ago you wanted to be a donor, and you apparently made contact here with the hospital.
Yes.
And said you'd like to be placed on the list and you'd be willing to make the donation.
Yep.
And then you were going through some things in your own life a little over a year ago,
Yep.
and they thought that because of some of the stuff that was going on, it would be better for you to wait.
Yeah.
That was probably almost 2 years ago.
Yeah.
And then, you know, a year and a half later, they check back and see how you're doing, and you're doing fine. And at this point, it's my understanding, you're thinking of a small child. And it made that kind of a commitment.
Yes.
Well, then I understand that when you're ready to make the donation, they don't have any small children.
No.
And I can only imagine the emotional ups and
I
downs.
was like, out of all these people in this huge world-class hospital, I was like, how is there nobody on the list? And I guess that's good.
Yeah,
But-
I'm ready, and you mean you don't have
Yeah,
a
you
patient.
make me wait a year and a half, and then, oh, sorry, there's nobody. I'm like, what do I do now?
So then what happened?
So it took them about a week or two, probably a week or two, and then they told me they did have somebody appear on the list,
And
and they gave me a call.
they
So,
gave you the call and said, hey,
yeah.
we do have somebody. So
Yeah.
I can only imagine the roller coaster, the up and the down, and you're ready to go in, and I've got a kidney here. Don't you have somebody out
Yeah,
there?
exactly.
That must have been really quite a thing. So you get the phone call.
My son actually got the phone
Okay.
call at home.
Now, I can only imagine, how was your health before this, Miguel?
I was sleeping too much. I couldn't think, and I was stressed out for a lot of things from this sick kidney I had. But that one day when I got the phone call, I picked it up. It was Loma in the hospital, and they told me that somebody want to donate a kidney to you, and I was like, you gotta be kidding me.
What news? Pick up the telephone.
Yes.
Loma Linda, we have a kidney. Are you still ready? So that must have been, really must have been an exciting time,
Yes.
because I understand that during the last 18 years, your health has kind of been up and down, and more down than anything else, and tired and sleeping a lot and no energy. And now, tell me, Liz, did he get to the point where he's ready? Did he ever have dialysis?
Yes, we did that for about 2 years.
For 2 years. This is when the kidney's in failure.
Yes.
And 2 year. And what is involved in getting dialysis? Is this you kind of go down and
Well,
there for 30 minutes and?
no, it's more like drive there at the crack of dawn, and you're there for 8 hours a day, flat on your back, hooked up to a machine. and then you're exhausted afterwards. So the day that you don't go to dialysis, you are sleeping that whole day.
So you're kind of recovering.
Yes.
You're either in dialysis,
Or you're
getting ready
sleeping.
for dialysis, or recovering from the
Yes,
dialysis.
exactly.
And this went on for 2 years.
Yes.
Yeah.
Every day. And how long would you go in for the hospital?
I don't know, probably like a couple hours, something like that.
About 8 hours a day.
8 hours a day, and
3
then you're
days a week.
driving in, and
Yes.
oh, this is terrible. And then you get the phone call.
Yes.
So he answered the phone. Were you there, or did you
No,
get the phone call a little later?
I
You
was
talked to
at
the
work,
people?
and you want to tell your story?
Yeah.
Yes. Well, you know, about I pick up the phone call, and I was talking with them for a while. Then I see my older sister Megan, and her boyfriend walks in. I give Megan to the phone, and then she talked with one of the nurses, I believe, and my sister was crying a little bit, and I was cheering all that. Then after that phone call, my sister called my mom. And my mom said, "This better not be a joke."
It's got to be a joke.
No,
I
and
really thought it was.
no, and then my mom was crying, and she got so happy. Then I called my brother Alex. I told him the good news, and he was so happy.
It must have been a time of rejoicing. A lot of people praying all during this period of time, and you know, I guess it's kind of an illustration about prayer. Sometimes we pray, and you know, God hears the prayers, and God always answers prayers, but He doesn't always answer in the way we think He's going to, or as quick as we think He's going to. So you undoubtedly been ready and praying. You're praying. The two of you don't know each
No.
other, and you get this phone call. And now, were you able to meet before the event took place?
Yes.
At first, they told me no. Yes.
They just
At
wanted
first
you to come
they
in.
said, no, the whole point of altruistic is you don't know the people, just in case. They don't want me, you know, getting scared and dropping at the last minute. They made sure, you know, no contact. But then they decided, oh, okay, maybe it's so close to surgery. They called them and asked if it was okay.
Yeah.
So, and who arranged the meeting?
The transplant coordinator at the hospital, she called me and she said, "We usually don't do this, but how do you feel about meeting her?" And I'm like, "Well, of course we want to meet her." And I was very excited, and so was he. And so we went and we met Michelle, and Mike took her a picture from his renal team prom that he had just gone to.
Renal team prom.
Yes,
okay.
it was very
There was,
exciting.
there was a couple celebrity, and Channel 11 News was there.
It was very exciting.
Wow, that is great.
And
So then you have this meeting.
yes,
And then how long afterwards do you have the surgery?
that was Wednesday, and we were in the OR the next Monday.
Next Monday.
Yes, the next Monday.
Yes.
So now, are we talking about one surgeon or a couple of surgeons? Or-
I'm sure there was many.
Okay.
Many.
Well, it
Yeah.
was, Michelle went in first,
Yes.
and then as soon as her part was done and your surgeon was Dr. Barone?
Yes, Dr. Brown.
And then Dr. Joho was Miguel's surgeon. And so Michelle went in first, and we waited, and then they were ready. They took him, and I sat in the waiting room with her family and heard wonderful stories from your grandmother, who's how old?
My great grandmother.
Oh, my
is
goodness,
89.
sorry.
Yeah.
89. So you're in the operating room, and they're removing your kidney and getting him ready to receive the kidney, and everybody's out in the
Telling
out in the waiting
stories
room,
about
having a
me.
good
Yes,
time,
we were.
telling stories and sharing.
It was
well, this
great.
is just an amazing story, Michelle, of your of your conviction of wanting to give and make a difference. It's not often that people can sit at a table and say, you know, I gave something to this individual, and because of that, the individual is living and going to make all the difference in the world. And
Most definitely.
Miguel, you look so good today, and you're healthy, and you're back in the homeschooling, and I can only imagine what it's like when you're anticipating going on dialysis, and when you go on dialysis, and you're talking about 3 times a week, 8 hours a day. I mean, that's your life. I mean, you're either getting ready for it, you're involved in it, or you're recovering from it.
Definitely.
And now we've got a whole new future. Tell me, what kind of an impact is this making on Mom?
Well, it was just so, like you were saying, God knows. He knows what he's doing. And with his first transplant, I went through some issues where there was a little bit of anger there and frustration.
In terms of the failure.
Yes, you know, why? And with this time, I just kind of prayed, gave it to God, and I just was very relaxed and calm about it. And when that phone call came, it just all came out. I was crying like a big baby at work. I had to go in the staff room, and it just, everything just flowed, went perfect. I couldn't have asked for a better script for it all if I had written it myself. I mean, it was just incredible. Everything was just wonderful. It was so amazing. It really was.
Well, Miguel, how did you feel when you heard that Michelle was going to give you this?
I was so happy and excited. I called every family member I know, and they were happy and they were crying. I mean, it was great.
It was just an unbelievable time. I mean, all of a sudden, you have a new lease on life.
Yes, I do.
And a new future, and the journey is going to be much better. Well, now, Michelle, you know, I know you're the mother of 3 children, and you've got a lot of friends. Tell me, what were they thinking at this time? You know, I mean, they think you kind of flipped out?
Yeah, basically. Yeah, they still don't seem to believe it. They're kind of like, what?
You did
and
what?
then, yeah, and then getting past the, I don't know the person, that's the next like hurdle. They're like, okay, you got to explain this to me.
You're
How
giving
do
a kidney to somebody you don't even know?
Organ to somebody that's just, you don't know them. You know, they're like, what's wrong with you? And then I talk to them, and they understand, you know.
Well, now, and I understand even this weekend you're going to be involved in some kind of an event.
Yes.
And what is that?
This weekend is a Donate for Life, which is the organization that, you know, helps us all through all this. So I'm doing a run walk this weekend for that.
Yeah, that is absolutely amazing. So you're continuing on, and Michelle, this gift that you're giving and have given, and you're continuing to give. There are people that are watching on this program now, and some of them have just been confronted with the news that either somebody in their family or a close friend of theirs is in need of a donor recipient. And we often don't think of, when we see somebody that, you know, like Miguel, who's had a kidney transplant, that somebody gave that gift.
Yeah.
And often it's a person whose life has come to an end and those organs have been saved and will make a difference. But here we're talking about somebody that is given the gift, that their whole life is ahead of them, and you're still ready to give that gift. Well, tell us what your plans are, Liz.
Well, I'm hoping that he'll be able to go back to school soon.
He's in homeschooling now.
Homeschooling now, and as soon as we're off of our...
Who's the homeschool teacher?
Mr. Egbert.
Okay.
Yes, and he's been wonderful, very supportive. They get along really well, and he's taken the time to really help him get caught up. And then once he goes back to school, he'll be a senior and he can graduate. And then we'll look into some programs for after that.
Oh, that is really great. So you're back in school now. Have you had a hard time doing your schoolwork here the last couple of months? Yeah. But you got is your teacher patient with you most of the time?
Yeah.
Okay. Well, now tell me what your plans are for him in the future now. I mean, you're going to get him back in school. He's
Definitely.
on homeschooling now.
We're gonna...
So as we're coming down to the end of the school year, I'm sure you're going to probably just let him finish up with this, not right now.
And then my plan is to maybe look into some summer school, just to get him back into the routine, and then we'll see, you know, how he feels in September, and hopefully he can go back and do a full day with some limitations, and you know, get him a little more in shape, a little bit, you know, from the prednisone and the steroids, that kind of, you know.
So now is he on a heavy medications that he's
Yes.
taking right now? Are you
Anti-rejection
taking quite a
drugs.
bit every day, I suppose?
I think about 12 pills 4 times a day. But
That's pretty heavy then.
yeah, but you know,
Yes,
he's...
it is.
Now, do we have him on an exercise program, or are you able to get out and walk yet?
Yes.
And are you participating in anything else? I mean, are you able to ride a bike yet?
Not yet. I'm working on that.
You're going to work on that, okay.
So he's been going to the gym. We just got off of our isolation because of, you know,
Sure,
the suppressed
didn't want to have
immunity.
any kind of problems.
So he's been going to the gym a couple of times with family members and getting back in that routine. And we're able to walk around the block and
So
And he's
do you
getting
get your mom out walking with you?
No,
Sometimes.
No, but I'm happy what my mom doing. She's going work every day. She's in a college that help her get her grade back up, so we could have a better future. You know, just keep on walking and see what happens next.
Well, our program is entitled Journey of Hope. And if there's ever been a couple or a group here that I've had that have been on a journey that needed hope, it's this family right here in front of me. And I know that God, I don't know what the future holds, but I can tell you, I know who holds the future.
Yeah.
And I know that God's got a wonderful plan for you,
Yes.
and Liz for you, and for the rest of your family, and Michelle, I know for you that this story is going to be told, and it's going to be retold and told again, and lives are going to be impacted in a wonderful, wonderful way. Well, have you thought what you'd like to do now that your health is getting a little bit better?
Like to go back to school, then go to college, and then learn how to drive.
Going to go to college and learn how to drive, and maybe not always in that order, but you
Yeah,
want to learn.
but I'm working on it.
You're working on it. Well, that's great. You got to, you have to be thinking ahead, and you got to be dreaming. Now, Michelle, what are your plans? I mean, you had surgery here a couple of months ago, and you're already going back to work. I mean, tell me, what kind of a recuperative program have you been on? I mean, you look absolutely great. Who would know that you're minus a kidney?
Yeah.
That you're a kidney donor.
Yeah.
So, but,
Yeah, nothing has changed.
nothing has changed.
I don't notice anything other than still being a little tired every once in a while. I sleep in a couple extra hours and I'm good. That's it.
And you're going to
So-
be going back to work, and you're also going to be going back to school.
Yes, I
And-
decided to switch schools and go to an actual automotive school now. So I'm going to get my AS in that and get that done. So
Well,
That's
so
good.
you're moving ahead. I mean, I can tell you right now that the best years of your life are going to be ahead of you.
Yeah.
And the story that is unfolding here is going to be told and retold, and there are other people that are going to hear, and there are other people say, hey, I could do something like
Yeah.
that. And people don't usually think of doing something until they hear a story, until they read it in the
Exactly.
paper, or until somebody down the neighborhood has a demand. And those of us that are removed from the day-to-day experience have no idea what some people actually go through. What kind of an impact does it have on the rest of the family?
It was kind of, I had to look for the words to explain it. And my family is like, okay, so you don't know this lady. Do you know why she wants to do it? What does she get out of it? All the normal questions. And I just explained it to them. And then once I met Michelle, and I asked her right there, why are you doing this? Because I was like, it's got to be
What's
something.
behind it?
Yes, what's the reason? I was so curious because when do you ever hear of anything? I mean, it's a kidney. How do you say thank you for a kidney?
Well, I've heard a few stories, but it's been, 1,000 miles away of somebody doing this. But I need to let you know, Michelle, I've never heard of anybody just like you that was willing to do this, that had a conviction, was ready to move ahead, had the idea they were going to donate to a child, and then because of some things that were happening in your life, you weren't able to do it at that particular, a lot of stresses that were happening.
Right.
And then the hospital has said, hey, we think you better wait. And about a year and a half later, you're ready to go, the hospital's ready to go, and then there's not anybody to be found. I mean, I talk about frustrating
Disappointment.
and disappointing.
Right.
And yet that phone rings, and how a phone call can change a life. And it's just a wonderful story that's unfolded here. And I know that God, Miguel, has got some wonderful plans for you. Things you don't even think about now. But as other kids hear about your story, you're going to be an encouragement to them. I mean, I can tell that you're a fighter, and you're not going to give up, and you're going to move ahead. And I know that your mother has got to be a fighter. And tell me what your plans are now.
Well, I just, like Miguel was saying, I just got my AS degree from Chaffey College.
Congratulations.
And now that he's got the kidney, I have applied for a position upgrade at work. So we're crossing our fingers, and I'm confident that I'll be able to handle that because now he's so much healthier. I can't even tell you. And so
This is a wonderful story of people who have gone through an amazing experience here, and all of you are building on the experience and have wonderful plans to grow and develop and improve and get your degrees, go to school, and all, you know, I'm anxiously going to be listening to when you get you finish up your schooling and when you go on to college and when you get your degree. You both got to let me know when this takes place. Again, for the audience that are watching, you know, this is just an incredible story of compassion and courage and generosity. A donor. Loma Linda Broadcasting Network, and particularly Journey of Hope, is a listener-sponsored program. And we thank you that have been watching and listening and praying for us and making donations that this can thrive. But here we have a donor that gave a gift that keeps on giving again and again and again. A life-changing donation. Thank you again for joining us here on Journey of Hope, and I know that your story is going to be an encouragement and an inspiration to our listening audience. For those of you that are watching, we want to thank you again for joining us. And each week we have stories of people that have been impacted here at Loma Linda University Medical Center, people whose lives have been changed, stories of people that are not only survivors, but thrivers. And our special guests today have once again demonstrated that what takes place here at Loma Linda makes a difference in people's lives. You give God a chance. He's going to change your life as you look to Him and trust in Him.